Member of Parliament Dr. Karen Cummings said today that there is a crisis at the Suddie Hospital.
There is a crisis at Suddie Hospital leading to high incidence of newborn deaths. Several nurses and doctors at the hospital have reported that there were no obstetricians and gynecologists on duty for the last 2 weeks. And as such, mothers and their babies were at risk of adverse pregnancy outcomes.
She said that both gynecologists were on leave. The gynecological department is without a specialist.
The chief medical officer had sent a general doctor, a medical practitioner who's not a specialist in, we will call it OB-GYN, obstetrics and gynecology, and even surgery, and to do surgeries and to more or less monitor the mothers, at-risk mothers.
She described the situation as incompetence on the part of the Ministry of Health. The new head of the department isn't qualified to undertake surgeries. To make matters worse, the neonatal unit has been deemed unsafe.
That there were at least 5 deaths in the month of June, which forced management to close the unit. Information pertaining to the deaths can be verified from the hospital records.
Dr. Cummings said that the pediatrician is also unavailable to manage the department. For at least 2 weeks, both the neonatal and pediatrics departments were covered by a Cuban doctor who isn't licensed to practice.
Our country's health system boasts 5 levels of health care, which range from the health posts, health centers, district hospitals, regional hospitals, and the referral hospital, Georgetown Hospital Corporation, level 5 we call it. Our system also in health in Guyana is also decentralized, as decision-making is spread throughout the 10 administrative regions, which allows for less bureaucracy, but rather a more efficient and better healthcare system.
She said that there was a $34 million input at the hospital. This was to retrofit the neonatal unit. At the same time, $24.1 million was provided for the nurses' hostel at the hospital.
Though there are several predictors of neonatal mortality, such as low birth weight, preterm births, and maybe the length of stay at the NICU. And when we consider complications of preterm birth, birth asphyxia, neonatal infections are among the common causes of neonatal mortality. The point is that such serious consequences and occurrences will reflect the type of prenatal, intrapartum, and neonatal care being offered at the facility.
She said there is need for an immediate investigation.